All 47 World Health Organization member states in the African region have unanimously adopted a new malaria framework for Africa. The new framework proposes specific priority interventions and actions to reach, quote, an African region free of malaria. WHO experts say that since 2000, malaria death rates have plunged by 66%, translating into 6.2 million lives saved. The WHO says malaria is no longer the leading cause of death among children in Sub-Saharan Africa. But despite the significant progress, malaria continues to be a major health and development problem in Africa. At least 89% of the global burden of malaria is in Sub-Saharan Africa, and most victims are children under the age of 5. The World Health Organization says $66 billion will be needed to eliminate the disease from Africa by 2030. Joining us now on the phone from Geneva, Switzerland, is Dr. Pedro Alonso, Director of the World Health Organization's Global Malaria Program. Dr. Alonso, welcome to the show.
Thank you very much.
Now, the new malaria framework proposes a specific priority interventions and action. What are some of the key priorities?
Well, I think you framed the question very well in your introduction. We have witnessed over the last decade a golden era in the fight against malaria with amazing, or rather historical and unprecedented progress, with very significant reductions, well in excess of 60% in mortality rates, incidence rates, and so great progress. But as you rightly also said, although malaria is no longer the leading cause of death, the number one cause of death, it still represents a massive burden on the health of the African continent, and particularly of its under 5 children, with close to 400,000 deaths every year. So not the leading cause of death, but a major cause of death and disability. Now, what has brought us all the way to where we are now? Well, the deployment, the scale-up in our core key malaria interventions, fighting the vector, essentially through the use of insecticide-treated bed nets, under which children and women, pregnant women, sleep, and that prevents them from getting infected. The scale-up in the deployment of rapid diagnostic tests, allowing adequate diagnosis even in the most remote areas, and access to artemisinin combination therapy, our first-line treatment, drugs for the treatment of malaria. What needs to be done is continue aggressively in the scale-up of our core interventions, because still today, well in excess of a quarter of all Africans do not sleep under an impregnated bed net. Still, in excess of 50% of all malaria cases go undiagnosed and untreated. So our challenge is, how do we vigorously go on scaling up our interventions to achieve the ambitious but achievable goals that the African framework poses.
Very ambitious indeed. And Dr. Alonso, the WHO says that annual funding for malaria will need to triple over the next years to achieve the 2030 target. Some critics say that donor money will not be enough, and African countries that are endemic are not funding and giving out the money that is needed. So where will the money come from?
From all of us. You're right. We do need, and we've witnessed with great satisfaction and encouragement the development of global funding mechanisms like the Global Fund to fight malaria, TB, and HIV. The bilateral initiatives like the U.S. President's Malaria Initiative, they've brought in, together with other key funders, major resources in the fight against malaria. But if we want to go on scaling up, if we want to go beyond our current level, extra resources will be required. And this should continue to be coming from our international effort, the international cooperation expressed through the different mechanisms. But we need to, and the countries need to increase the domestic resources devoted to the fight against malaria. Tripling the funding will not come only from a sustained effort from our international partners, but requires more funding from the countries.
We have to leave it there, Dr. Alonso. Thank you so much for joining us today.
My pleasure.
And that was Dr. Pedro Alonso. He is director of the World Health Organization's Global Malaria Program. Now, a new release report details the damage of Zika infections on the developing brain goes well beyond microcephaly. The latest research draws from imaging and autopsy findings linked with confirmed Zika infections done on 17 infants and fetuses in northeastern Brazil and 28 fetuses or newborns with brain anomalies whose mothers were suspected of having Zika during pregnancy. Nearly all babies in each group had a ventriculomegaly, a condition in which the ventricles or fluid-filled spaces in the brain are enlarged. While most of the fetuses had abnormally small head circumference, suggesting they had microcephaly, 3 of the fetuses had normal head circumference but severe ventriculomegaly. The research was published in the journal Radiology. Experts from the World Health Organization warned that a shortage of HIV testing could undermine global efforts to diagnose and treat people with the infection. They looked at responses to annual surveys that the WHO had sent to 127 countries between 2012 and 2014. The survey asked about capacity and usage of blood tests that check HIV status and health. They found worrying gaps in provision despite some improvements. Reasons for the gaps in provision including lack of reagents, equipment not being installed or maintained properly, and inadequate or absent staff training. Private sector testing was not evaluated in the survey.